health is not just the absence of a disease, it is the inner joyfulness that should be ours all the time, a state of positive well-being. Deepak Kapoor. Welcome to Living at Your Finest podcast. I'm your host, Dr. Babs. I'm a triple board certified family, obesity, and lifestyle medicine physician, and I am the founder of Living at Your Finest Wellness, a holistic direct primary care practice. Did you know that 80% of lifestyle-related chronic diseases within our communities are preventable, with poor diet being the primary culprit? Now, contrary to what we thought, that it was our unfortunate genes, the good news is that we can make changes together to improve our health and quality of life. So that's what this podcast is all about. The Living at Your Finest podcast is devoted to helping families to live at their finest well-being using a holistic approach with a healthy lifestyle to nourish and flourish as a whole, vibrant, and healthy champion. So join me and my guests as we share transformational and sustainable skill sets from our health and wellness journey to support you and your families in achieving optimal well-being. Ready to live at your finest? Well, let's get to it. Hello, health champions. Welcome back to the Living at Your Finest podcast show. I was not going to let the month of November go by without reflecting on the Lifestyle Medicine Conference. Lifestyle Medicine hit this landmark 20 years of existence, and I'm so super proud and honored to be part of that landmark. Today, I want to reflect on just lessons learned, want to share with my community, want us to be healthier together. So that's the essence of this podcast episode. I'm going to share and reflect on my top 5 lessons learned. I'm going to share some of the insights and presentations, and then some things that we can do together to make our world a better place. But before I do that, I want to check in with you and see how you're doing. How are you feeling? You enjoyed Thanksgiving if you're in the United States, and if you're not in the United States, every day is Thanksgiving, right? So I am grateful for each and every one of you. Thank you so much every day for tuning in to my podcast show. I truly am honored. I do this because of you. So thank you for giving me your ears, allowing me in your platform. So let's get started. I want to share that ACLM, which is the American College of Lifestyle Medicine, celebrated 20-year anniversary. Over 4,000 physicians all over the world came to just get immersed in the amazing research, right, that improves our health and longevity through lifestyle changes. And in case you're hearing about lifestyle for the first time, lifestyle medicine, what in the world is that? I just keep it simple by saying it's an evidence-based medical approach to not only prevent, to treat, and reverse chronic lifestyle-related conditions through lifestyle interventions. So incredible, so important. So as I reflect on the experience that I had just attending this conference, we all gathered to learn, to share and inspire each other. And it was all gathered around the 6 powerful pillars of lifestyle medicine, right? As I already mentioned, what its goal was really about. And it was really to educate each and every one of us to harness this powerful tool of medicine, all right? We know that when people understand their health, they make choices and they improve their lives. I know this happened for me. It was transformational for me when I learned about lifestyle medicine shortly before the pandemic and immersed myself in it, got boarded in lifestyle medicine, and I really understood the power of whole person care, whole person approach. It was able to transform my health, my family's health, and now with my patients by opening up a direct primary care practice where I have enough time to prioritize my patients' care. So let's dive in. As a physician, I've seen that knowledge transforms our lives, right? It's just what it is. We either fuel our health or we feed disease. And if our goal is to fuel our health and not feed disease, then we need to be empowered. So my mission is always to raise awareness about how our daily habits impact our well-being. So going from nutrition to physical activity for stress management, sleep, restorative sleep, social connection, as well as avoidance of substance abuse. So when we empower each other, we just lift each other up. We encourage each other. I know in my home, if I'm falling off the wagon, I have people to remind me, and I do the same for them, right? So we don't just do it through education, and not through judgment or pressure, because it's progress over perfection, but we do it by providing the tools for better health choices. All right. So when we do this, we have healthy homes, healthy communities. So each session during the conference was really enforced by several just several presentations, some that were so important. And so, I mean, they were all important, but for me, my biggest highlight was just talking about lifestyle medicine management to enhance neurological health and memory through plant-based eating. I mean, I know now that if my plate is not filled with fiber, I tell myself, have I really fed myself, or have I just enjoyed eating without being mindful of my brain health, my gut health, my immune system? So that was one. Another thing was also about PCOS. A lot of people are having hormonal issues, menopausal stuff going on. This is physiology. Well, how is food, how is stress impacting just modulating our gut microbiome? So that was also another one. We had a renowned expert, Dr. Robert Weindiger. I hope I didn't mispronounce this very well. He shared his pivotal findings from an 85-year study of happiness and health during his captivative keynotes presentation. And it was so impactful. Happiness matters. It's not the state of not having things that make you sad, but just the inner joy and inner peace. Another highlight of the whole presentation and the whole conference was also the impact of religion and spirituality on our health, right? And not just whether you're a Christian, but just having something that matters to you, that you believe in, that wakes you up, right? You have this connectivity to your inner being, right? So those were some of the highlights, and there were so many of them. But because of time, I just highlighted those few. But let us talk about my big 5 takeaways. All right. As I mentioned, it was a true milestone. We had 2,500 live attendees all celebrating this. We participated in a run. It was fun, a 5K run. There were yoga sessions in the morning and the evening. I mean, it was just a lot of great fun. And it was just everybody coming together. So my number one takeaway was the fact that I didn't know that ACLM struggled at the beginning. So American College of Lifestyle Medicine. So for them to get their voice on the table, they struggled. They were almost going down, but they kept pushing. The leaders kept pushing. And for that, I am grateful that they pushed and they kept pushing. Because what would have happened if they quit and they said, nobody's going to listen to us? But they kept pushing. They kept pushing. And now it's been inducted into the American Medical Association House of Delegates. Isn't that amazing? Giving lifestyle medicine a voice in the national health policy. So this is so important. It just tells me, when I started my podcast in 2020, I needed a voice. I needed an outlet. I was fed up of medicine. I knew that I wanted to be a doctor because I wanted to heal people. I am not the healer. God is the healer, but I wanted him to use me to heal people, not just give a prescription that it will end up coming saying they have a complication or a side effects. Now, medicine has its place. Believe me, I know it does, because it helped me get my blood pressure down. But what made me reverse it was just the lifestyle pillars. So I know medications have its place, but I more so lifestyle medicine really brought the joy of medicine just all back for me. So I'm so proud that ACLM stuck with it. 10 past presidents were all on the stage and they talked about the struggle and the triumph. So I'm so glad that they've been recognized as medical education that is guiding future care towards prevention and patient-centered lifestyle care. Thank you so much for joining me on this week's episode. My goal on this podcast is to empower, educate, and encourage you to take actionable steps to triumph at living at your finest, body, mind, and spirit. Of note, the information provided here is for educational purposes only and does not substitute as medical advice. Please discuss your healthcare needs with your licensed medical professional. If you are in need of a compassionate and comprehensive holistic physician, or know someone who is, please reach out through my website, livewellness.com, for a meet and greet. It will be my honor to talk to you. Are we connected on social media yet? I share more in-depth content on best practices to ensure that you live at your finest daily. So please join me on Facebook, Instagram, YouTube at Living at Your Finest Wellness, where we can learn together and stay connected. Lastly, please subscribe to iTunes if you have not done so already, and share the podcast within your circle of influence. An extra step, leave a review and let me know what topics or discussions you would like to hear more of. Thanks in advance. It is always a thing of joy to hear from you. Now, let's get back to today's episode. Number 2, food as medicine. I know this for sure. Food is medicine. food can heal. I come from family history of arthritis, and I know what turmeric, black pepper, I know what cutting back on sugary stuff, even though I have a sweet tooth, finding alternative ways of eating sweet and enjoying sweet than eating processed sweets, right? So this was so important. Food is medicine. There were so many demonstrations of how we can make our foods, how we can use herbs and spices to just brighten up our food, eat the rainbow. And more than that, the therapeutic dose, because it matters. If you just say once every week or once every 2 weeks, you eat healthy, and then the rest of the month you eat crap, that's not going to help you. That is not a therapeutic dose. So that was so important for me. And then what I learned, and I didn't know about this Netflix movie created by Professor Christopher Gardner. He did this twin studies that reviewed diet profound impact on chronic disease risk, right? So this was showcased inspiring and scalable food as medicine program, where I guess twins born and raised in different places, and really what happened to them, was one healthier than the other. Definitely something I plan to watch. But food is medicine. Countless times I've heard it. I've experienced it personally. We need to make sure, even if you're not a vegetarian, I am not, I still eat chicken and fish, right? But I make sure that I eat organic, and I'm not eating it all the time. I'm making sure that my plate is plant-based forward, okay? So majority of my food is plant-based. I eat the legumes, the nuts and seeds. I have my grains, whole grains. I have my fruits and my veggies. So that's where we need to stay majority of the time. All right. Number 3, the world as a blue zone. Have you heard about the blue zone? Yeah. Okay. Well, this is a place where people live long and vibrant life. It's not just about how long you live, but how healthy and well you live. So it was great to have our keynote speaker, Dan Butler. He came and he shared his NIH backed research showing how continents like the Okinawa and the Sardinia achieved extraordinary longevity through simple lifestyle-based habits. It was so elaborate. It was great to hear him. There's a place in California as well. I believe there are about 5 blue zones, but now they're going to expand it. This is work done by the former ACLM president and so many other people that came together to make a bold goal that most places, if not all, will become blue zones. And blue zones, again, is places where they're eating more healthy foods from the soil, minimally processed foods. So that it was so important to hear about this. And he said something which was fun. And I want you to play along with me, because I'm a strong believer of measuring. If you don't measure, you cannot manage. So I want you to join me, because he had about 7 questions. And I want you to get a pen and a paper. You can pause right now, because I want you to do this, because this is how we know how we're doing. Okay. It's not judgment. It's not shame or anything. I just want you to know where you are so you can make some improvement. So I want you to start off wherever you're doing good on it. Just raise your hand or do a check back on your paper. So the first question is, do you sleep at least 7 hours every night, or most nights, or 80% of the time? Yeah. Okay. That's one. If you do, it does correlate with maximum life expectancy. Question 2, do you at least move 20 minutes a day? Whether it's in the gym, gardening, whatever, at least 20 minutes you're moving. All right. Number 3, raise your hand or make a check box if you eat at least 5 to 7 servings of veggies and fruits and all the whole grains and all of that a day. All right. Number 4, this was a funny one and I don't know how it applies, but raise your hand if you have not had unprotected sex with a stranger. All right. All right. Number 5, this is a really interesting one. Social connections is not just about having social connections and having friends, but friends, number 1, that you like. Number 2, that you can have meaningful conversation with. And number 3, if you're having a bad day, you can call them. So if you have all of that, then you are great. If you know somebody in your life that you can do that. And then 6 was raise your hand if your height is at least twice your waistline, right? So your height, whatever your height is, your waistline, this should be twice your waistline. So if your waistline is 23, then your height should be bigger. So you shouldn't have your waist higher than your height. Does that make sense? Okay. And then the last one is you haven't smoked in the last 5 years, smoked cigarette. So do the math. How many times did you raise your hand? Put it down and let me give you the statistics. All right, so if you raised your hand twice and you're a male, your life expectancy is 71 and a female is 75. If you raised your hand 5 times, right, and you are a male, 83 life year expectancy in terms of years and 87 for women. If you raised your hand more than 7, or about 7, then your life expectancy is 92. And if you're a woman, for men 92 and for a woman 96. All right, let's continue with my top 5. Now we're at number 4. Health equity is so important. It's part of our DNA, health equity, and it's central to ACLM mission. It has to be covered and represented in everywhere. We have to make things affordable. We have to make things easy. We have to make healthy the easy choice and not the difficult choice. When we say food is expensive, but really a can of beans is not as expensive as meat, or eating fast foods now are more expensive. So really educating our people, educating our communities so that they realize that lifestyle medicine is accessible to all, and partnering with organizations to make things healthier for our kids. I am so passionate about children because in my home, we struggle. We are foodies, but how can we eat healthier foods? Not always carb heavy, eating foods that are as close to the soil. So that's so important that we need to be very mindful of. Last but not the least is the greatest legacy is helping others win. And that is each other, understanding that we can do it together. When they say, if you want to go fast, go alone. If you want to go far, go together. So we need to spread the word about lifestyle habits and interventions. It's not about perfection. It's about making progress every day to heal and be better. Social connections, the legacy of compassion, of connectivity, all of that matters. So thank you so much for listening to the very end. I hope that you were able to resonate with all the information I shared. I know that this was health restorative for me as well as my family, and I hope that it does the same to you. Please let me know if you have any questions. The takeaway here is that together, these pillars are the foundation of a healthier future, and not one man can do it alone. We all need each other, and we all deserve to live at our finest well-being because we're worth it. Until next time, take care. God bless.